Hello and welcome to our listeners around the world. You are listening to the JAMA Health Forum monthly podcast. I'm Dr. Sandro Galea, Margaret Ryan, Dean of the School of Public Health, and Eugene and Constance Kahn, Distinguished Professor at the Washington University in St. Louis. I have the privilege of serving as the new Editor-in-Chief of JAMA Health Forum. I'm delighted to be speaking today with Drs. Melinda Bunton and Dr. Julie Donahue.
Hello, I'm Dr. Melinda Bunton, Bloomberg Distinguished Professor of Health Policy and Economics at Johns Hopkins University. I've served as Deputy Editor for JAMA Health Forum for the past 5 years, and I'm now starting a new role at the journal as Senior Associate Editor for Editorial Content.
And I'm Dr. Julie Donahue, Professor and Chair in the Department of Health Policy and Management in the School of Public Health at the University of Pittsburgh. And starting this month, I will serve as the new Deputy Editor of JAMA Health Forum.
So thank you for joining us. Before we start, a brief reminder that JAMA Health Forum is a peer-reviewed, open-access online journal focused on health policy, healthcare systems, and population health, and one of 12 specialty journals in the JAMA network. The monthly podcast highlights new content from the journal and offers interviews with authors and thinkers in health policy. Follow us on jamahealthforum.com, on Apple Podcasts, or wherever you get your multimedia, and on jamanetworkaudio.com. Now, we are this week transitioning leadership at JAMA Health Forum. Dr. John Ayanian, who started the journal and made it a leading voice in the field, is stepping down as editor-in-chief after 5 years. I have the privilege and somewhat daunting responsibility of following John in this role. Before we begin, thank you, John, for all you have done for the journal and the field. Respecting this moment of transition, we wanted today to look ahead. To do so, we are centering the conversation on the editorial I wrote in the journal published this week about the future of health policy science and scholarship and the role the journal can play in the field going forward. So let me start, Melinda, with a question for you with a look back. You've been involved in the journal for the past 5 years. Can you talk a little bit about how the conversation about health has changed in the 5 years since JAMA Health Forum was started? And how would you say the publication has intersected with this change?
Thanks, Sandra. I would say that when John and I were founding the journal 5 years ago, we, of course, had no idea that we would be publishing our first content coincident with a global pandemic. But in some ways, we really had the good fortune to be in what the network referred to as the channel stage at the beginning of the COVID-19 pandemic, because we could publish extremely quickly. We had the ability to take content in, shape it, and get it out into the field as quickly as the pandemic era demanded. And that included content that related to health policy in general. We then moved to the full peer review stage, but we kept that speed and nimbleness and focus on what was really important. And I think we have served in the past 5 years as a place that works on a medical journal timeline, but publishes things with very sophisticated methods and really detailed policy analysis. So we have helped to shape the conversation about health policy in general by being able to provide that deep content, but nimbly and on a fast timeline.
Thank you, Melinda. Now, Julie, let's look forward. Can you talk us through what you think are some of the big questions that will define the conversation about health policy and the systems and structures that shape health in the next 5 years?
So one big question I have is about technology and how we regulate it. And here I'm thinking specifically about artificial intelligence or AI. A second question is about how our health will be affected by policies that are not explicitly targeting healthcare delivery. Here I'm thinking about the environment and climate, which is a global concern, immigration, changes in housing affordability, and more. And I hope to see continued research on how state and local governments and health systems are addressing social determinants of health in novel ways. And I think these innovations require rigorous research. And I'm generally curious about where major health policy change will come from in the U.S., how power may shift from the federal government to state governments, and how our federal bureaucracies built up over decades to address health issues are going to change in the coming years.
Julie, we are in January and we have just been through a federal election and we are about to have a new administration. Can you talk a little bit about how you think the election and new administration will intersect with health and the health policy conversation in coming years?
I think the U.S. election will have a dramatic effect on health and health policy, despite the fact that it was seldom talked about in the presidential campaign and did not rank highly as a voting issue. I think we'll see the new administration and some members of Congress make a major push to reduce federal spending On entitlements, that will likely take the form of efforts to cut Medicaid spending, which would require congressional action. On the discretionary spending side, I think we'll see proposals to cut NIH and other federal research funding agencies, public health, and certainly changes to environmental protection. These cuts could put a lot of fiscal pressure on state and local governments, and they will also have a huge effect on universities and the biomedical and public health science enterprise in the United States. And finally, I think we'll see major efforts at deregulation. And to some extent, that happens with any change in administration, but I think there will be a new appetite for deregulation in the coming years.
Yeah, thank you, Julie. Let's shift a bit to the journal now. And Melinda, let me come to you. So you're taking on this new role as Senior Associate Editor for editorial content. How do you see us in this role continuing to strike a balance between maintaining dispassion in the science and also engaging with issues that are very much contemporary in the public eye?
Well, I'm glad you asked the question that way, because I do think that this is something that JAMA Health Forum has been very good at. All of us involved with the journal invest in this enterprise because we care deeply about health policy issues. And we have a very diverse set of editors, forum contributors, reviewers, and authors of all kinds. And we encourage reader comments online. And all of these things ensure that we're publishing the best science and we're reviewing it well. But fundamentally, it's going to come down to our contributors. So I would just urge anyone listening who has a viewpoint, who has an opinion that would constitute editorial content, to please submit it, because we are interested in hearing from all of you.
So Melinda, let's talk a little bit about another aspect that you and I have talked about building more in the 2025 on, which is to encourage governmental and other organizations to share perspectives and insights about reports, policies that are emerging. Can you talk a little bit more about this?
Yes, this is something that's close to my heart because I worked in government and I worked for a non-academic research organization. And I know how hard it is sometimes to take something that you produce when you're in one of those roles and take the time to put it through the peer review process, submit it to a journal and the like. But so much of that content is critically important to the discussion, and so many of the people authoring those reports deserve to see their work presented to a wider audience and indexed so it can be found by everyone. And so what I include in my plan is reaching out to people, and I've already started this process, to just let them know that if you are working for a research organization, a think tank, even advocacy organization or governmental organization, we are interested in working with you and making the peer review process work with what other processes are in place at your organization and in a reasonable amount of time, so that your work can become more widely available and easily accessible.
Thank you, Melinda. I'm looking forward to us building this in the journal. Julie, let me ask about the whole JAMA family, because one of our advantages in this journal is that we're part of the JAMA family of journals with 13 journals. How do you see us leveraging that relationship with the other journals in the JAMA family to move forward with what we're trying to do with JAMA Health Forum?
I think we are uniquely positioned as one of few journals in the JAMA network to publish empirical papers and viewpoints on cross-cutting health challenges and policy interventions that affect a broad range of populations, clinical conditions, and health interventions. But we can team up with the specialty journals that focus on specific health issues or diseases or populations to reach a much wider audience than if we were a standalone health policy journal. So it's a great position to be in.
I agree. Julie, let me pick up on something you mentioned earlier, which is technology. I think we're at a really exciting time about the intersection of health with emerging technologies. Can you just elaborate a little bit more on your thoughts about the intersection of new technologies with health policy, specifically scholarship in science, and what do you see the journal's role in encouraging and reporting on this evolution?
Sure. So our regulatory agencies that approve technologies and our payers making decisions about what to cover, how to pay for technologies, are really set up to evaluate technologies developed by biopharmaceutical and device manufacturers that rely on basic science conducted in academic medical centers. In the next 5 years, many of the disruptive technologies coming from AI will be developed by companies that typically operate outside of the biopharmaceutical and device industries, and that may be marketing unregulated products directly to consumers completely outside of traditional healthcare delivery. And our regulatory systems are not really set up to handle this and to regulate emerging applications of AI to health. So I'd love to see JAMA Health Forum publishing rigorous evaluations of these tools, weighing in on how to assess the benefits and the risks of these new technologies, publishing viewpoints on how our regulatory systems need to adapt, what authority Congress needs to give agencies to regulate these technologies, so that we are maximizing the benefits and minimizing the harms of AI, both of which could be substantial.
That's exciting to think about in the future, Julie. And I'd love now to ask Sandro a question because I think it's also important for our listeners to hear from you. So what do you see unfolding at the journal over the next few years, and what might change under your leadership?
Yeah, thank you, Melinda. The heart of the journal is not going to change. The heart of this journal is publishing excellent science and scholarship and publishing rigorous, thoughtful perspectives and viewpoints around areas that we are all concerned about. And I think that remains, and our goal is to keep that going and do ever better at that. What I see us evolving is to broaden our lens a bit. When we think about health policy, particularly through a US-based lens, we historically have thought about policies that are specific to the structure and service delivery of healthcare. I think we are at a point in history where we understand that the policies, the systems, the structures that affect health are broader than healthcare delivery. And I think we want to take that lens and to understand that we want to continue our focus on US healthcare as we have, but also look at other policy systems and structures that surround all of us and that makes us healthy. And I think we also want to take a more global lens, both to learn from other countries and to bring health policy systems and structures conversations globally. We are refreshing our editorial board member. We have a number of new colleagues who are joining us in the editorial team who take a global perspective. And I think there will be quite an interesting evolution intellectually for us as a field, with the journal leading that evolution.
And Sandro, one last question for you that will hopefully have us end on a positive note. We are in a time of challenge and opportunity for health. What gives you hope in this moment?
These sound paradoxical, but a lot gives me hope. I see optimism, to quote Ron LaBonté, as a studied act of political resistance. I think it's important to lean into hope. And by that, I mean action that can create a better world. And I believe in the business of ideas. This is the business we're in. We're in the business of publishing the best possible ideas, taking good science, helping it be better, publishing it, moving it on the world, publishing rigorous viewpoints that help advance the health conversation. And it is through this effort that ideas change in the world. And ideas lead to a better world and better health. And I think the fact that we have the opportunity to do that through the journal, opportunity to do it together, and by together I don't just mean Sandro, Melinda, and Julie. I actually mean, yes, the entire editorial team, the editorial board, but all the authors and all the readers who engage in the ideas of the journal. The fact that that enterprise exists fills me with hope, and it is a privilege to be a part of it. Well, thank you both. That was a really interesting conversation. I'm Sandro Galea. I've been having a conversation with Drs. Melinda Bunton and Julie Donahue, and we've been talking about the future of health policy research and scholarship and the next chapter in the history of JAMA Health Forum. You can find a link to my article on these topics in this episode's description, and I want to say thank you to Julie and Melinda for this conversation and for all the work we shall do together. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or look for JAMA Network wherever you get your podcasts. Thank you for listening, for being a part of the conversation.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.